The following portion of Daytime is sponsored by ImageLift. Welcome back, everyone. Are your friends telling you, you look great? And you're thinking, they're just being nice. It happens so gradually. Most of us don't notice we're getting older until we see pictures of ourselves from 10 to 15 years ago and we think, how can I get a little bit of that back? Here to talk about the perception of aging in our faces is ImageLift's double board certified plastic surgeon, Dr. Richard Castellano. Good to have you here.
Thank you for having me.
So how are we perceiving our faces as we age?
It's very interesting. You know, we go through different changes in our lives. We'll go through growth spurts. We also go through aging spurts. And we may go through stress or a difficult time in our life or a breakup in a relationship, and our body can go catabolic and you just lose a lot of volume, and then it's very gradual, but when it happens, there's this moment, and then it feels very sudden. So I hear this a lot from patients, and today we're going to talk about what you can do about it, because we age in three main ways. We sag, we get sun damage to our skin, and we lose that volume. We're going to talk about volume loss today.
Well, everybody wants to get that volume back, because when you think about a little baby and the big chubby cheeks, and they're so youthful. And then as you get older, it just starts to go, well, it starts to disappear.
Yes, and that's a great analogy when you think of younger face versus older face. So I brought a diagram today. I'm going to show how we age, how we lose that volume, because we lose volume in the skin and soft tissue, and we lose it in the bone. So if you take a look here, you see the skin, the muscle, and the fat that we've got. The skin, it ages, it thins out, you get wrinkles, and it starts to sag. We lose the fat cells in our face, one cell at a time. Women get closer to menopause, the hormones go down, and that area thins out. The muscle layer also attenuates as well. What's interesting is when you lose that soft tissue layer, that can make you look a little more tired, low energy, or even unapproachable. Now, consider that we lose volume in the bone, because we get osteoporosis, osteopenia. It doesn't just happen in the joints, it happens in the skull. So take a look here. You see our normal skull when we're younger. As we age, that bone thins out, and the bone around the rim, the orbital rim which holds the contents of the eye, that actually gets a little wider. Our cheekbone gets a little smaller and flatter. The jaw even thins out a little bit, and the bones around the teeth will also thin, and you can see that there's like this little ridge we get under our teeth that starts getting deeper and deeper as we age. That's bone loss, and you won't see that in children. So when patients get an understanding of what happens here, they really realize how it can impact you. We're treating this today with a very effective treatment. It builds collagen in the face, can last 2 years or longer, and you can have it done, no downtime, no surgery.
So you just go into the office and what, do you inject it into the face?
Right, we call it our liquid image lift, and we do a series of injections. People have little or no bruising at all. There's no downtime. You can go right back to work. Now the process will build up over a period of 6 to 8 weeks, so it's a little delayed gratification.
Okay.
But it works, it's effective, and if you have the right artist doing it, the results are natural. And I'll show you some results here of what it can do, because what happens is when we look at people, we make a decision immediately. Is that an older or younger person based on various visual cues? You see this woman on the left, you see that ring around her eye, you see that that orbital rim has opened up. And on the right-hand side, you see I've covered that rim with some volume, and now it makes her look younger. You'll see in the next picture.
And her cheeks were sunken in at first, and now they're not.
The cheekbone, it seems more full because we put volume in the right places. It's not perfect for her, but it's better, and it looks natural. I'll show you the next picture here. You see, this is only volume. If you put volume in the right places, it makes you look younger. It's like a liquid facelift. No surgery, no downtime. I'll show you another picture here.
That's incredible. She looks like she had an awfully good sleep.
Thank you very much. And here's the next photo where you see this woman did have a lift under the neck, but we did see that circle on the left side. You see that rim. Well, we cover it up. It makes you look younger. So we can help you hide those visual cues of aging, because people judge that. They see it in a second. Their mind knows. They don't even have to think about it. Is that older or younger person? This is why, and this is what we can do about it.
So people are losing volume in the soft tissue and the bone.
That's correct. And this process, it mimics the bone that you lose, it mimics the fat that you lose, and it makes your skin a little firmer. So it's a wonderful treatment, and it's very much in demand.
Who doesn't want to get a little firmer? That's great. ImageLift wants you to call now. Dr. Castellano, thank you very much.
Thank you for having me.
I need a little bit of filling going on right here. Daytime will be right back. The preceding portion of Daytime was sponsored by ImageLift.